We're very fortunate to have an outstanding person with us today here, Dr. Ted Epperly. He was born and raised in Idaho. Briefly, he got a medical degree from University of Washington, spent 20 years in the Army, retired as a colonel. He was the head of 135,000 family doctors in the United States. He's quite instrumental in Obamacare starting. He has met with President Obama and testified before Congress, among many other things. So I will let him take it from here. If he can go ahead and start, if you'd like to, Dr. Ted.
Okay, well, good afternoon to all of you Green Valley Democrats, both in Arizona, but also the guests from Colorado and Kentucky. It's a beautiful sunny day here in Boise, Idaho, Southwest Idaho, for those of you that have never been to the beautiful state of Idaho. It doesn't quite compare to your 80-degree day that's sunny. And it's marvelous to have 26 people join on a beautiful afternoon. And my goal is to make that worth your time today. So what we're going to talk about is kind of the direction of healthcare for 25 to 35 minutes under Joe Biden. Thankfully, back on somewhat of track given the previous administration. And then have time for any questions and answers on any of the topics that you might want. I see myself as a resource to you today, so feel free to ask away. I'm going to thank both George and Paul for asking me. We just needed Ringo and John, and we could have had a wonderful Beatles quartet here. I was a drummer, a rock drummer back in the day, so that would be my instrument if I were to be playing. I'm going to pull up my slides now, make sure that I can do that and get that all set for you all. And, I only have about 9 slides to share with you because I wanted to have plenty of time for interaction with you all, which I think will be the important part of this. So we'll take it away from here. As George had mentioned, and as Paul reiterated, I have quite a bit of experience in medicine. I've 42 years, I've been a family medicine physician. I've seen well over 100,000 patients by this point in my career. I've delivered 1,500 babies. I've led a lot of things as well. When I was in the military, I led different programs and departments, different hospitals. I was in the first Gulf War as a MASH trauma physician in the emergency room. So I've seen a lot in my years. That's why my hair is gray. But I had a lot to do with the Affordable Care Act's creation. As Paul had mentioned, I had the opportunity to meet with President Obama and his chief staff administrative people 6 times back in the 2009-2010 corridor, as well as testify to Congress and different subcommittees of Congress 18 times. So what I'm talking to you about has been long overdue for our nation. It's still long overdue for our nation, but I can speak with some degree of personal experience with both the process of this and the content and outcome of this. So I'm going to go ahead and advance if I can. And I think I have to, there we go. And I'm going to just drag this over here a little bit. Okay, so as President Biden came into office, and I'm grateful for him, you know, the nice thing in talking with you all as Democrats is we all get why it was important that we got Trump out, just so the nation could start to heal and move forward the best we can in a very polarized nation. I've never in my years seen anything as devastatingly polarizing as what we've been through in this last 4 or 5 years. I know that we've had issues in our country for a long time, but nothing like where we've gotten. It's all become extremely weaponized, as you all know, and it's going to take a lot for us to recover from all of this. But at the end of the day, we've still got to be thinking ahead and looking forward to what can we collectively do to make things better. I mean, that's the thing I love about Democrats, quite frankly, is that they have a bigger picture of what's best for the public and common good, really, that underscores what we do. So it's good to be with you and to talk amongst you in terms of efforts that need to continue to happen. So thankfully, with Biden getting in, at least the 84 attempts to stop the Affordable Care Act will at least temporarily halt, at least for another 3 years. I can't make any promises as to what will happen afterwards. You know, it just beats the hell out of me why it is that doing something for the communities and the nation's health is seen somehow as such a political issue, but it has become that, as you're all aware. Several of the first things that President Biden did when he got into office were to immediately change some of the executive orders that Trump had put in place, travel bans. He reinstated interstate masking for flights or bus travel. He increased the Defense Production Act authorization for vaccination, which really helped start to make quite a bit of vaccines across the nation. And he did an important thing in helping us get back into the World Health Organization after we had shunned the WHO in regards to a temper tantrum that Donald Trump had because he blamed the WHO for disrespecting him and the United States position on COVID-19 and vaccination. So I'm thankful to see that things like that were done immediately by Joe Biden when he got into office. It speaks to me loudly about starting to restore at least some degree of sanity in regards to what we're trying to do as a nation. I can tell you that COVID-19 has sucked most of the oxygen out of our nation and the world as all of the world has gone through this, and it will continue to be front and center quite vividly, I think, for the next year or so. It's hard to predict what will happen with the virus. We've had 4 surges, as you're all aware. Each of the surges lasts about 2 months in length. It's very interesting. And these surges occur regionally across the United States and regionally across the world. It's not one big sweeping wave that moves from east to west or from west to east. It's pockets. And right now, the Intermountain West is going through an intense period, all the way from Alaska through Idaho, Montana, Wyoming, Utah, down into New Mexico. I'm sure that Arizona, if not having a bit of an uptick, has recently or will recently. That's where the hot spot in the United States is. My state of Idaho was the 5th most active state here just recently. We've kind of hit our crest for the 4th surge, and it's starting to drop off, and it's starting to move again a bit further to the east, so that we're seeing, again, the Intermountain states start to have increased uptick. One of the things I'm watching carefully, quite frankly, and I could spend this whole talk on COVID-19. I was on our public health department board for 15 years through this pandemic as well, is the fact that I think one of the real barometers of disease activity that might portend a 5th surge will be the northeastern part of the United States. And the reason I say that is the states in the northeastern part, Vermont in particular, are heavily vaccinated. They're 70, 75% vaccinated. Some states approaching 80% in the Northeast. They have developed quite a bit of herd immunity. People have taken this very seriously in that neck of the woods, so that if they start to see an uptick there, we should be worried about a fifth surge with either the Delta Plus variant or potentially the Mu variant, which is out of South America. So we'll be watching that. There are about 75 active subvariants of the Delta virus. So again, I'd love to say we're totally out of the woods, but we're not. What I will say, though, is that the numbers are dramatically down across the United States. We went from about 160,000 cases a day not too long ago, 4 to 6, 8 weeks ago, to about 70,000 cases a day. That's about half of what we were experiencing. And some of the modeling data shows that those numbers will continue to drop through Thanksgiving, through Christmas, and into the early part of 2022. Now, what's hard to predict, of course, is as we gather as families over Thanksgiving, Christmas, New Year's, will there be a bit of an uptick? And that's why it's really, really important. I really want to emphasize this point, that we get as many 5 to 12-year-olds vaccinated as is possible. The way to put out the fire, probably the quickest, is to get the most number of people vaccinated across the planet, and especially kids, because kids can be a tremendous vector for this, because they don't get as sick. Although some can get very sick and die, they don't get as sick. Their symptoms are a bit masked, and they can take it home to older people, either their parents, grandparents, or great-grandparents that may or may not have had a vaccine and can get infected. And that's why it's really important to kind of do this. So I'm pleased that the Biden administration is putting full speed ahead in terms of getting vaccines out there, continuing to push hard for appropriate vaccine mandates. I think it is absolutely essential we do this to stop the pandemic. And of course, we got to keep an eye on the variants. At the same time, we'll start to refine and refocus on the Affordable Care Act and try to get back on track with that. I want to just reiterate what happened to create the Affordable Care Act was needed. And that is that, and I think most of us on this call would agree, that healthcare is a basic right. I don't understand, quite frankly, why we're so divided on this particular issue. If we take a look at healthcare and most of the other industrialized nations on this planet, they've looked at healthcare as being a basic right. And they've figured out how to best handle that then in regards to making sure people stay as healthy as possible. Why should we do that? Because it maximizes the potential of our nation. If we've got people that are living inequitably with poor health, that doesn't maximize our nation's productivity. It actually hurts it. What it does do is it keeps the status quo in place of certain people having more rights than others. And that becomes a problem. I'll never forget Martin Luther King once saying, the greatest form of inhumanity and inequity is the unequalness of healthcare. And there is a lot of truth in that. It's been used, I think, sadly, as a bit of a weapon to keep different ethnic and racial groups in place. And that's why if we are ever going to advance beyond where we are as a nation, we've got to work hard on two major things. One is the equality of healthcare, and the second is the equality of education. And the reason for that is that everybody then can have their best shot at being their best selves and their best humans, and then equally give back then to America for doing that. So part of the big thing with the Affordable Care Act was start to get us back on the track of healthcare being a basic right to people and trying to get as many people covered as possible. So the Patient Protection and Affordable Care Act, PPACA as it got called, and of course shortened to the ACA or the Affordable Care Act, came about in March of 2010. And it had two major parts. There was the patient protection part, meaning that we'd try to cover as many people as possible. Now, remember at that time, there were 50 million people in the United States that were uninsured. Because of the ACA, that dropped to 20 million. That has recently increased to about 30 million because of the pandemic. But also equally as frightening is that there's about 50 to 80 million more Americans that are underinsured. They have some sort of insurance, but they don't have enough insurance. So all of them live potentially one heartbeat away of having some major medical calamity happen that could potentially bankrupt them. The sad thing to me as a physician of 42 years is the leading cause of bankruptcy in our nation is from personal medical expenses. That's not right. We shouldn't create a system of healthcare that potentially bankrupts many, many citizens of our nation. So part of the strategy in terms of the expansion of coverage, again, getting back to the notion that healthcare is a basic human right, is to expand Medicaid. Let's help the poorest of the poor make sure they've got basic health insurance so that they can help have better health to get out of poverty, to help them achieve their greatest potential. One other avenue that's actively being explored, but I don't think there'll be the congressional votes for it, is to drop Medicare to the age of 60. I can tell you as a physician, I see a lot of people get really sick between the ages of 60 and 65. Why? Because they're getting older. Why? Because many of them retire from work a little early and may or may not have health insurance during this period of time. So they just hold their breath until they can qualify for Medicare, and they live sicker. And some die younger than they needed to, because they ignore the hypertension or the diabetes or the hypercholesterolemia or the chest pain or the hip pain. And so they slam into Medicare at age 65, and then all of a sudden we've got 4 to 5 years worth of healthcare problems that should have been treated upstream more effectively than waiting for it to be treated downstream. The public plan option is a governmental program that would compete on the health exchanges, but have a governmental program so that the administrative cost of that would be less, and it would compete with health insurance. The health insurance industry hated this idea back in the creation of the Affordable Care Act because they believed that it would undervalue their product and potentially not have a level playing field for their product, and they were concerned about the finances of it. So it got excluded from the Affordable Care Act. The Biden administration has signaled that it will take a heavy look at bringing back a public plan option for the health insurance exchanges across America. Personally, I don't mind a hybrid system. So that we've got basic healthcare coverage for everybody. And if people want to get additional insurance, then fine. You know, it is America. They can do what they want with this. But we should at least make sure that everybody's got insurance. I think we can all agree with that. At least the Democrats can agree with that. And of course, at the end of the day, we want to make sure they have access to a system where they have a personal relationship with someone they trust that can provide quality healthcare for them. So the second part of the Patient Protection and Affordable Care Act was the Affordable Care part, right? So right now, care for every man, woman, and child in this country is right at about $11,500 a year. It went up 4.2% during the pandemic, and that leads to a $3.85 trillion system, $3.85 trillion. And you would think, well, if we're going to be paying 3.85 trillion, which is more than triple the next closest country on the planet, that we ought to have better healthcare outcomes. So I would love to be able to tell you that's the case, but sadly, that's far from the case. If you take a look at the World Health Organization's rankings of health status of citizens across this planet, where the United States as a country ranks as 37th. And if you take a look at that list, who's first on that list is France, and who's in 36th place, one ahead of us, is Costa Rica. Now, you know, I'd love to go to Costa Rica one day. I hear it's breathtakingly beautiful, love to go there. but you got to be kidding me. We can't do better than Costa Rica with a $3.8 trillion spend to have a better healthcare system than they do. And part of the problem, of course, is the inequity in healthcare. We've got many people who have means that can get whatever they want. In fact, they probably overutilize the system. And we have even more people who underutilize the system because they don't have the means to get the appropriate care at the appropriate time in the appropriate place. And so they basically live sicker and die younger. And that's one of the basic problems with our healthcare system, is that we have built a system perfectly to handle disease, not to prevent disease, not to keep people healthy, but to treat disease once it's started. And that's a high cost approach to healthcare. It would be much cheaper, much more cost effective to prevent the diseases in the first place. I mean, think about it. Think about yourself. I don't want to be waiting in an emergency room to be seen for something that should have been handled in my physician's office. I don't even want to be in my physician's office to get treated for something if I could do something myself to prevent it and have the system work with me proactively, technologically, in a way that would keep me healthy. And of course, I need to be accountable with exercise and good diet. I know one of our viewers right now is walking his 4 miles while he listens, and good for you for doing that. We should all be more active. But my point is that we've perfectly created a system to do what it does, and that is to make money. And the way you make money in healthcare is you treat disease. You put out people when they start on fire. You don't keep the fire from happening in the first place. So part of the Affordable Care Act was to really start to control cost by moving upstream with prevention, move away from sick care to health care, to start to integrate and coordinate better, to drop the GDP spend from 18%, where it is currently, to 15%. I'm here to tell you a third, and this is well documented, of healthcare is waste. It's duplication. It's redundancy. Why? Because we don't have integration and coordination in the system. It's almost like having the 5 best basketball players on the planet, and we play a team from Spain or France or the United Kingdom or New Zealand, and we lose. Well, how is it that the best 5 players on the planet can lose to a team from France or New Zealand or Hong Kong? And it's because we don't pass the ball. We're great shooters. We shoot a lot. We shoot every time we get the ball, but we don't pass the ball. And so we get beat by a team that does. What we don't do in the American health care system is integrate and coordinate as well as we should. Why? Because we don't get paid to integrate and coordinate. We get paid to do things to people, procedures, ICU care, hospital care. It's not something that we've focused on doing. And so part of the big deal with the Affordable Care Act was to really start to transform the system so that we could move away from reactive disease care and move it upstream to proactive health care. So with that, there were also insurance reforms with pre-existing conditions, and to try to drop the administrative overhead to a nationwide average of about 15% to where it is in Medicaid and Medicare, which is about 3%. We need to wring out all the excess cost in the system because that is bankrupting the nation. As I mentioned earlier, we're at about 18% GDP. The Biden administration wants to set a target to get that down to 15%. The problem is if we don't get this under control, the data shows that we'll go to about 25% of the nation's GDP being in healthcare in 2030 and about 50% in 2050. So it's an escalating increase in healthcare costs that starts to suck the vitality out of our nation. So what else is going to change and is changing with the Biden administration? Well, we'll see more and more efforts towards a single payer system. Now, again, I mentioned earlier, it's fine with me to have a hybrid system as long as we have everybody covered. Right now, we have a little over 50% of the nation already on a single payer system. I think sometimes that's forgotten by people, but when you total the lives that are paid for by Medicare and Medicaid, by the VA, by the Department of Defense, by the Indian Health Service, we have over 50% of Americans already having a single payer. So what's the big deal? Let's try to put our heads together and get this under control. Why we don't is what I discovered when I was the president of the American Academy of Family Physicians, and that is that the lobby in Washington, D.C., by the health insurance industry in particular, to keep the status quo just what it is very powerful. They don't want to lose all of that revenue. The pharmaceutical industry doesn't want to lose all that revenue. The American Hospital Association doesn't want to lose all that revenue. And I'm sad to tell you that so does America's doctors. Most of them are happy with exactly the way the system is working because it's been extremely lucrative for them. And again, I'm not trying to be critical here. I'm just trying to point out the systems issues and why it's so difficult to change. But see, our priority is wrong. It shouldn't be about the doctors. It shouldn't be about the hospitals. It shouldn't be about the pharmaceutical system. It shouldn't be about the insurers. It should be about the patients of the United States of America. That's what our focus should be on, is what can we do to keep them healthier and then redirect the systems transformation to make sure we achieve that. That is a major change in thinking. And that's part of what the Affordable Care Act was all about. That is the part that I had a lot to do with, was to try to get under the hood of this incredibly expensive vehicle and start to fiddle around with how do we start to do that. I'll never forget, we all like stories, so I'm going to tell you one. I'll never forget a run-in I had with the president of the American Medical Association. At the time, I was the president of the American Academy of Family Physicians. Wonderful guy, crew cut, a very healthy cardiothoracic surgeon. And he said to me, Ted, God bless you family doctors. He said, we know we need a whole lot more of you, but let me make one thing crystal clear to you. We will fight you to the death for every penny you try to take out of our pocket. And therein lies the visceral nature of trying to transform a $3.8 trillion system. I found out there were 3.8 trillion reasons people had to keep it exactly like it was. So with this and other changes we'll see will be increased usage of telehealth. Just like I'm zooming into all of you today, there is no reason, I can tell you, as a practicing physician, there's no reason I can't take care of a lot of people by telehealth. Why? Because I know them. The relationship with them is good. I'm very clear on what sorts of symptoms lead to certain sorts of problems. I can make good decisions on most people. Yes, there will always be a subset that I've got to see physically and touch and feel and examine. But the technology is coming along quite well. And I can provide care to somebody that saves them a tremendous amount of expense in driving to see me. So the whole nation is working on increasing both quality and outcomes, better health outcomes. And this can be seen in this third bullet point as increased value. What increased value is increasing the quality of care while cost also drops. Anything that's going to increase quality while cost stays same is going to be valuable. Anything that keeps quality the same that drops cost will be valuable. When we do both, increase quality and decrease cost, then we really, really have a lot of value. And one of the things that people recognize we've got to move away from to get to that is we've got to decrease fee for service, meaning that we've got to get off the model of see one, do one, bill one. It leads to overutilization in the system. It's much better in a value-based payment model to pay for a group of people to keep them healthy, and then you and the team work together to do that so that there aren't individual costs associated with this. Now, how I know about all of that is that, as Paul had mentioned to you at the onset, I spent 21 years in the United States Army. That's the way the Army health system and the Department of Defense health system works. We don't charge people for individual visits. We get paid a lump sum of money to keep them healthy. And so health and success in healthcare in a capitated system in which you're paying to keep people healthy on a per member per month basis or a per member per year system is exactly the opposite of our current system. So a sign of success in that system would be to have an empty waiting room, or a waiting room with only 1 or 2, maybe 5 patients a day that are coming through it. Why? Because everybody else is healthy. They're out walking, they're out doing their things. We're managing things either by telehealth or telephone calls or email in proactive ways to keep them healthy. Remember my example of I don't want to be sitting in my doctor's office if I don't have to be? Well, that's exactly the point. So let's move away and transform the payment system to a better delivery system that aligns then with that as an outcome. Because of that, we'll start to see more community-based care at home. The mantra there is the highest quality of care as close to home as is possible. All right, what else will change? There's going to be a reemphasis on public health. Boy, did I see that get trashed during COVID-19 pandemic, especially under Trump. I mean, Anthony Fauci was made to look out like he was Satan himself in regards to what he was trying to do for America's public health. And in fact, I went from being a healthcare hero to a healthcare villain in my own community for the public health stances we were taking to try to help people stay safe during the pandemic. Damnedest thing I've ever seen. And I think many of you can relate to that as you went through your own versions of this in your own communities. Joe Biden rejoined us to the World Health Organization, which we should have never run from in the first place. And the other big thing, and I'd alluded to this earlier, was this whole issue of the social determinants of health. We're recognizing that, again, there's a lot of factors that are playing into people's poor health. Lack of transportation, lack of education, lack of finances, lack of good housing, food insecurity. And look at this, the poor not only live sicker and die younger, but during the pandemic, not only did they get infected more, but they were dying at 4 times the rate of our white counterparts. Native Americans, 4 times the rate. Hispanics, 3 times the rate. Not only were they essential workers that needed to go to work and be exposed to the potential ravage of COVID-19, they didn't have the healthcare resources to then help them when they got sick from it and didn't get the type of healthcare early enough to make a difference for them. It has nothing to do with their genetics. It had everything to do with the social determinants of their health. So what else? I think one thing I would tell you is that doctors, scientists, experts will start to be listened to again. Hopefully, it's just been a hell of a ride in regards to, again, just the temperament of the nation and a subset of people that are just hell-bent on attacking what they perceive to be the elite. And I can't understand that. I don't feel like I'm an elite person. I'm just trying to be an average family doctor in Boise, Idaho, trying to care for people and trying to do the best I can to make a change in the nation's healthcare system. So, you know, again, I think you've all witnessed this. It's been quite a journey we've all been on. One thing that President Biden will do is increase the war on cancer, and I'm glad for that. Cancer is the second leading cause of death in our nation. He's got close personal experience with that, with his oldest son, of course, dying from brain cancer. He'll also continue to focus quite a bit of effort on decreasing pharmaceutical costs, increasing gun violence research, which has long been tramped down by the GOP and the NRA. And I'll tell you, as physicians across this nation, we've been very disappointed and upset by that. We recognize there's a lot that's going on that could be better done from a public health perspective around gun violence, but it's been kind of thwarted. So I think we'll absolutely see a fairly large uptick in the next 3 years around that. There will be a decrease in balance billing and surprise billing. Why? So that people don't get hit with unnecessary healthcare costs. And I think all of that will be very beneficial. All right, just 2 more slides, I think, and we'll be done and can open it up for some questions from you all. One of the things that President Biden has really signaled that he's going to really work on is both health cost and financing. For all the reasons that I'd mentioned earlier, it was part of the Affordable Care Act, is to try to get healthcare costs under control. There will be an optimization of health and well-being for women and children, which is long overdue. Many of you may know that we have one of the world's largest rates in the industrialized world for maternal mortality after childbirth. Now, that is shocking to me. And again, if you take a look at who's dying after childbirth in this country, it's the Blacks, it's the Hispanics, and it's the Native Americans. It's people without means. It's people that don't get appropriate healthcare access at an appropriate time. So that'll be a real focus as we try to, again, help with the equity issues and the inequity issues and health disparity issues that we see across populations in our nation because of unequal access to healthcare. There is a great effort on transforming mental health and addiction services. As many of you know, these have become big issues. I think the pandemic absolutely worsened both of them, and mental health in particular is a huge problem in our nation. The 3 Achilles heels of the current American healthcare system are the lack of quality and timely primary care, the lack of quality and timely behavioral and mental health care, and the lack of quality and timely oral health care. The dental aspects are equally challenging for people without means. Just before our call started today, I had a really good question come up from Matthew, and Helen, 2 of our participants today, who wanted me to quickly mention what I thought might be coming with dental and vision care by Medicare. And as I told them, I wouldn't hold your breath. I don't see that happening. Everybody recognizes that dental and vision care is important, but the cost of it will be staggering and a great challenge, and we just won't get the votes to get it through. What is going to happen, though, and I'm pleased for this, is that at least in terms of hearing and for hearing aids, there will be programs that will be done by Medicare and others to start to pay for hearing aids, which again is really important because social isolation for people is a big deal, especially as we all get older. One of the most socially isolating issues that people can have is the lack of hearing. So I think that'll be important. There will be a refocus on better health and healthcare for older adults, which is long overdue. There needs to be a whole lot more done in the community and with home healthcare to keep people, again, as healthy as is possible, as close to home as is possible. And then lastly, for infectious disease threats, we'll see a heightened increase activity as well. What you may or may not remember is that in our lifetimes, for the people on this call right now, we've already had 4 pandemics. We've had 3 prior ones to this one. 1957, we had an influenza outbreak that was fairly serious, 1.1 million people dying across the world. Now, just put that in perspective with COVID-19, we have 5 million people across the world that's already died and more to follow with COVID-19. 1968, we had the Hong Kong flu. For those of you that may remember that or may have been sickened by it. 2009, we had the H1N1 swine flu. That was a major deal. And of course, then in late 2019, early 2020, and into 2021 and beyond, we have the current SARS coronavirus COVID-19 pandemic. Now, we've already had several major brushes with different infectious diseases. You all may remember well the West Nile virus that swept across the nation, Zika virus most recently, the SARS coronavirus 1 that threatened the world as a pandemic, but it got shut down real quick with appropriate efforts. So we've got a lot to learn from how to handle our infectious diseases. We're only a setup for more of them. Why? Because of climate change. Climate change is starting to have interactions with different species of animals and humans in different ways that propagate quite a bit of viruses. And the animal transmission to humans and human back to animal and have different variants and mutations happen become a huge breeding pool for potential pandemics. So what we'll probably see, because as the world gets crowded and pushed together more with climate change, reducing livable land into places where people are now starting to crowd together more, will be the production of more pandemics. So again, we better get good at this because we're going to have more coming. So with that, I'm going to end with one slide here. And I like to end with this because, again, if we could just focus on some of our commonalities and not the differences, I think we can move the ball down the field so much farther. So Republicans and Democrats agree on about 80% of the following. Nobody's arguing that they want a higher cost healthcare system. I know of no one that said that. I don't know of anybody that's arguing about not having improved quality in the system or greater access to appropriate healthcare, better prevention and wellness, having an integrated and coordinated system through a patient-centered medical home where you have a relationship with a physician that you know and like and trust that can be there for you to help you navigate through a complicated system. And that bottom bullet, we can't afford not to do this. We'll jeopardize the entire financial underpinnings of our nation if we can't get this under control and rob future generations of the resources they need to do a better job with governing and managing not only our nation, but a nation that's undergoing a lot of change through either climate change or infrastructure issues, as we all know. So I've given you a lot to think about there with this talk. That's probably why I got asked to do it. You can all tell that I'm passionate about this. It's important. These are big deals. These are big ticket items. These are big picture items. And that's why I'm proud to call myself a Democrat, because the Democrats have a bigger perspective on how to try to solve these things. The problem with some of my colleagues in the Republican side of the aisle, and there are many who very much agree with trying to do some of these things. I don't want to paint with too broad a brush, but one thing I've been left with many of them is they just don't care about this as much as I think my fellow Democrats do. They don't see that this is an important thing. They don't see that, why should I have to do something about this? This is an individual responsibility. It's not a systems issue. It's an individual issue. And I'm going, you got to be kidding me. This is a massive systems issue, and it's going to need a systems approach to try to fix it. So with that, I'm going to stop. More than happy to take questions that you might have. And I hope that, to my first point, that the time that I've spent with you and the time that we'll have for Q&A will have made this a worthwhile hour for you. And I'll stop there.
Let me read them. Actually, here's one from Barbara. I actually have concerns about a hybrid products for healthcare. I realize that concerns negotiations for necessity to get accepted, but the health insurance companies and big pharmas really do not give up anything as a matter of fact that have continued a massive, huge profit. Until these segments are under control, we cannot have fair healthcare to the masses. Any response to that, Doctor?
Yeah, I agree, Barbara, with the direction of your question. I think it's the practicality of it, though, in regards to there's so many Republicans that are so dug in on this position that will just never get the votes to do that. What it'll take, I think, for enough Republicans to agree with the premise of your question is either COVID gets a lot worse and kills a whole lot more people, or we have a total financial meltdown in our nation so that we need to build from the ashes a new America. Remember how the national health insurance got started in England. It started in 1947, right after World War II. London and England had been devastated, especially London, with the Blitz. And part of the platform politically at that time was to build a better country. And healthcare became one of the major platforms on which they did it. So I think to use that analogy now going forward, unless we have a whole lot worse things happen, i.e. more deaths from COVID or some other catastrophe, or that we have some financial meltdown, we just won't see enough Republicans do this. I'm going to make one more comment here and I'll stop. Ted Kennedy said one of the biggest mistakes he made in his life was not to accept the healthcare plan offered by Richard Nixon. Richard Nixon actually had a pretty good healthcare plan that would have helped America down the road a whole lot more with the sorts of things I've been talking about. But Ted Kennedy dug in his heels. He really wanted a much more of a single payer system. And he said it was one of the biggest things he lamented in the latter years of his life, is that he didn't accept that and take a compromise just to move the ball forward. So I hope that's in some way helpful, at least as an answer as I see it.
They've had, Helen and Matthew have had their hands up. So can you guys turn on your video and unmute, please?
Yeah, this is something that's personal for us, but first of all, I want to really thank you, Dr. Epperly, for being here and for everything you've had to say. Obviously, you're quite learned in this and you presented extremely well. And thanks, Paul, for having Dr. Epperly here. My question is, when we talk about improved healthcare so that people don't get sick in the first place, diet is a big thing, something that we have personal experience with now after following Dr. Michael Greger's books on how not to die and how not to diet. And I don't expect everybody to run out and become a vegan or a plant-based whole food, but the meat and dairy industry kind of has a lock on our mentality. And I think a lot of that contributes to the ill health. And certainly if you follow our efforts, we got off all our medications following Dr. Greger's recommendations. And the other part of that is the meat and dairy industry is responsible for a fair amount of methane gas, which is a global warming gas that's much worse than carbon per molecule. So is there anything that you have seen or heard that would lead us to believe that there might be something in the works, how to address this? Because I just don't see any hope, because most people are so addicted to meat and dairy. That's my question.
Yeah, that's a great question, Matthew. A couple of things I would say is that, bless our heart, America has always been about making money. That's at the base of the core of capitalism, right? So this isn't the first time that America has been hoodwinked around tobacco, around sugar, and around meat and dairy. We absolutely have been hoodwinked in regards to the money-making efforts of all those major industries to make large amounts of money. I'm almost embarrassed to tell you the amount of education I got in medical school around nutrition and diet is almost non-existent, except for vitamin deficiencies. And the reason for it is that we were so focused on stamping out disease, not preventing it in the first place, right? It gets back to the basic premise of we were taught in medical school to take care of sick and dying people, not in trying to keep them healthy. And so I think totally in agreement that we are what we eat. And I think we must be better educated and must take it on ourselves to try to do what we can to be as knowledgeable about what we consume and what we should and shouldn't consume as we possibly can. Part of America's challenge with nutrition is obesity. We just have consumed a whole lot more calories than we've expended energy for. Obesity is tied to all sorts of diseases, cardiovascular disease, different cancers, stroke, et cetera. And so I think back to the personal accountability part of the equation is that we've got to all do a better job with this. Now, one other point I'll make on this is that I think all things in moderation. So it's certainly appropriate from time to time, and I don't want to offend anybody by saying that appropriate meat consumption is fine. I think we just have to do a better job with analyzing what portions and percentages of our diets. We've gotten off track a bit in our country. You take a look at other countries, and they have a lot more vegetable, nuts, fruit consumption than we do in the United States. Very heavy on meat in our country. So I think there's a ton of what you're saying here that's really, really important. And that is that we've all got to be personally accountable for the best health we can deliver to ourselves. And part of that starts exactly with your commitment to daily activity, at least 30 minutes cumulatively per day, 5 days a week, and watching what you eat. The other thing I'm going to add in here, physician experience, is to stay well hydrated. I'm probably not speaking too out of turn for those of you in Arizona, but as a country, America is a dehydrated country. And so much can happen in a body that's 70% water if you continue to have appropriate hydration. If you start to get dehydrated in a body that's 70% water, then different chemical interactions can happen that usually would have been halted by having an appropriate hydration. So that is one of the other tips I'll just throw out there, along with exercise and nutrition, is appropriate hydration. And I'll stop with that.
Okay, good. I'm going to go back and forth between chats and raised hands. This is the chat question from Henny. Are there any proposals in the works on reducing drug prices that have a chance of passing? If so, how effective would it be?
Yeah, that's a great question. There are, there's many things I'll never forgive George W. Bush for, but one of the things that he did was at the nth hour and the 24th hour late at night allowed Medicare Part D to get passed the way it did. And what it was a transfer of billions of dollars to the pharmaceutical industry in regards to not having competitive pricing for Medicare, by Medicare for pharmaceuticals. So it's been long understood that part of the rising cost of healthcare is not only, again, doing better prevention and coordination of care upstream, it's by the excessive costs of pharmaceuticals downstream. So a lot of attention is being paid to this. The pharmaceutical industry is complaining markedly about this, of course. They say from their perspective that, look, it costs us a lot of infrastructure costs to generate new drugs for America. We've got, our research and design, R&D expenses. And so they were given a 7-year period of no competition so that they could try to make up those costs back so that they would continue to pump the pipeline with new medicines. That got extended to 10 years in the recent past. And so what's happening now is to try to dial down the competition so that there is more competition in regards to drug pricing so that the costs of medicines go down and this period of time of being free from competition is better handled so that the overall costs start to decrease. So I am pleased with the efforts being made, although slow. Again, it's back to the 3.8 trillion reasons to keep the status quo the same with all the pharmaceutical lobby. And by the way, the most potent lobby in America on healthcare is the pharmaceutical industry, not hospitals, not doctors, not insurance plans. It's actually the pharmaceutical industry because of the degree of margin they make. So I am happy to say that we're moving in the right direction, not fast enough, but there are good efforts being made to try to get this under better control. I'll stop with that.
Okay, watch the show Dope Sick if you get a chance on Hulu. It's all about that. It's all about the Purdue Pharma. Okay, Doug has his hand up. So Doug, you want to unmute and turn on your camera?
Yeah, I have my camera turned on. I hope you can see me. And a couple of things. Number one, just as an interesting fact, I was watching an article or talk on the subject of the Irish genome. Turns out that the Irish are best able to handle lactose. So it's no wonder we have a lot of dairy. But what was really of interest to me was the mention of Costa Rica and the fact that their outcomes are better than ours at a very much lower annual cost. I was wondering if you could comment on how we might be able to take up some of their methodologies. Thank you very much.
It goes back to, again, how our system is built. The system in America is built to make money, not to keep people healthy. So things don't change in this country until we have a mental attitude change politically and socially, that what we're all in this for is to try to keep people as healthy as possible. So what Costa Rica and those other countries are doing is, first of all, they have a mindset that health is better than treating disease. It's more cost effective. And they also have adopted that principle that it is everybody's right to have access to healthcare. So those fundamental premises are really important. Those are two of the things they're doing better. Now, let me let you know what America does with a capitalistic healthcare model like this. And I'm a perfect example of this. So I went to medical school and I fell in love with family medicine. I wasn't in this to make gobs of money. I was in this to try to come back to my native state of Idaho and provide good health care to the people of my community and my state. Well, in medicine, again, the primary care doctors get looked down on by the system. The system basically says, you know, I guess you just weren't good enough to be one of us, a neurosurgeon or an orthopedic surgeon or a cardiologist. And what the system did, of course, that drove so many people going into the subspecialties or into the surgical specialties is they paid them more. So they make 2 to 3 to 4 to 5 times more than your average family medicine doctor, your average pediatrician, your average internal medicine doctor. So now apply this to scale across the country. We've got the wrong team on the field as we're trying to wrestle healthcare back to an upstream, let's keep people healthy as possible. We have too many radiologists, too many neurosurgeons, too many dermatologists, too many ologists, not enough of the primary care doctors that basically start to apply this prevention, integration, and control sorts of system. So my point in digressing, Doug, on that is that it starts with a basic attitude in the nation, and then starting to write the system in terms of how it pays for healthcare so that we stop overproducing the wrong types of physicians. Now, true, we need to have an appropriate number, neurosurgeons, orthopedic surgeons, cardiologists, but we can't have that exclude the basic primary care doctors that need to produce wellness and health. And so that is part of the challenge of changing the system as well, is that the medical schools have gotten way off track with overproducing certain types of physicians that have the mindset of then going into medicine to make a lot of money. They then go from medical school into residencies so that they can then subspecialize into these esoteric areas where they're only handling certain numbers of patients with highly complicated issues, highly complicated disease, and highly complicated procedures. Hence, limited, well-living lifestyle, making lots of money, while the nation struggles because they can't get basic access to care. And that's how it plays out for Blacks, Hispanics, and Native Americans. They don't have those types of doctors in enough sufficient quantity to be able to then give that kind of health care to their communities. So again, probably a lot for all of you about inside baseball, if you will, of what is happening systemically in a system that's badly broken.
How can we restore confidence in doctors, scientists, and public health officials? Answer that one within an hour, okay?
Well, I think it starts with people just recognizing we're all in this together. Nobody's trying to, harm anybody. What I saw happen with Anthony Fauci and physicians at writ large by the Trump administration was a total disrespect for their knowledge and expertise when all they were trying to do is to help the nation. So I think we have to have it role modeled from the top. One thing, and why I certainly voted for Joe Biden, was to start to restore a respect for expertise, for knowledge, for science, so that people like Anthony Fauci could be respected again for what he could offer, so the CDC could be respected, so the NIH could be respected for what we're trying to do for America's health. I think it starts for each of us at our own locations as well, trying to role model professionalism and respect, trying to care for people, but try to educate them as to what the issues are too, so that we can grow from this and hopefully heal from this. So I think we'll get there eventually. It kind of depends on what's going to happen with this next election. But, I'm actually quite pleased with Virginia in the sense of at least the Republican governor who won didn't win on a Trump platform. He distanced himself from Trump, and maybe that'll be beneficial. Even if we swing back to Republican leadership, if we can just stay away from the right-wing, mean-spirited Republican approach and have a much more moderate, respectful, we're all in this together approach. So again, maybe more than you ever wanted to hear, and I don't necessarily want to become overly political, but this is the intersection of politics now, society, healthcare, and how it all starts to play out.
Mm-hmm. And it is political. Here's a couple comments. One, Jeannie Buell says, hello. That's a short one. Another comment from Sandy Eckstein. Excellent speaker and agree with him in all ways after my 43 years of cardiology nurse case management in the Hopkins system. and on down. A friend of mine from Kentucky, Bruce, says, you have covered the medical care facts well, but what of your faith in our institutional ability to meet these challenges? Federal, congressional, federal agencies, professional associations, special interest groups, two-party political system, etc. Can you boil that one down?
Boy, yeah, that's a long one too. But I'll give you a good short effort. First, I want to say hi to my friend Jeannie Buell. I've known her for over a decade from time in Idaho, and wish Jeannie the best of health down in Arizona. And we miss you up here in Idaho, Jeannie. So anytime you want to come back for a visit, please let me know. I think much of the problem that lies in American medicine has to be solved at a federal level. We've got to wrap our heads around major principles and concepts. The basic right to healthcare, again, as an individual's right. I think we as a nation need to grapple with that. That is a huge thing. Once we align on that, then we can start to act on that. But if we're going to be tore apart, and the polls show about a 50-50 split in the country about is healthcare a basic individual right or not, I think it's going to be hard to solve the problem. I think the federal government is going to be good at helping us get lined up on principles and values. It will help a lot with payment systems, Medicare, Medicaid, and potentially helping rein in a lot of the abuse, either with pharmaceutical industry or the insurance industry. Now, having said that, I also think the states need to step up. And a lot of healthcare is local, of course. So states need to kind of own this as well in terms of trying to do what they can to transform healthcare, as do local communities. So it's kind of all up to all of us to do our part with this, both in terms of who we vote for, who we support, but again, back to our individual accountability for our own health as well. How much you're exercising, how much you're eating, what are you doing to try to make sure that you keep yourself as healthy as possible? Maybe one thing I want to mention here quickly, because this is important, Paul, and part of our talk didn't talk about this today, and that is in dying. We all are going to die. Here's how I want to die. I don't want to be in a hospital. I don't want to be in an ICU. I don't want to be on a ventilator, and I don't want to be hooked up to a bunch of lines lying half naked on a bed with people in my room who I don't know. That's not how I want to die. How I want to die is at home. I want to be warm. I want to be dry. I want to be surrounded by people who love me. I want my dog on my bed. And that's how I want to leave this world. Now, all of that has nothing to do with high-cost medicine. It has everything to do with me planning, talking with my wife, with my healthcare provider, with my team to make sure that that happens. Now, I recognize if I get in a traffic accident going home tonight after this talk, that, yep, I'm going to go to a hospital and be cared for, and that's okay. I'm not, hopefully, I'm not going to die from that.
Zoom, zoom.
But if I am going to have cancer or some, bad chronic disease that happens, that is how I want to go out. And so I share that with you kind of in closing, because how we handle death in this country is very expensive. We don't have these sorts of conversations or knowledge internal to all of us. And so the system does what the system will do. It tries to save you. And there's a lot of cost in that. 40% of all of the cost in Medicare in your lifetime will happen in the last 2 years of your life. And 70% of that will happen in the last 6 months. So my point is that we all need to kind of pay attention to this, be proactive about our health, our healthcare, be proactive about our thoughts about dying as well. We can't just allow the system to continue to run amok trying to do everything to save all of us, unless, of course, it's something that is reasonably expected to be saved. So with that, maybe I'll close with that. Paul, I recognize there are probably other questions. If you want me to handle some more, I'm more than happy to. And as you can see, there's a ton around all these issues that we could talk about, I know, for a couple, probably a couple more hours. And I would just offer to you all, I'd be more than happy to come back at another time, 6-8 months from now, and have another topic with you as you see fit, if that would be something you'd like to do. And with that, Paul, I'll turn it back to you.
Yeah, we'd love to have you back. I just have a yes or no answer question for you. Seems like Canada, for example, has a pretty good healthcare system, but it requires taxes to pay for. The right wing is allergic to taxes, so this may never happen because it's going to require somebody paying for it. That's just yes or no. What do you think?
Yes, okay. That is correct. Right. The reason France has the best healthcare system in the world is they pay for it.
Yeah.
They have a much higher tax rate than America does. So you're exactly right. This has to come out of somewhere. But I can tell you, because a third of it that we're paying for now is waste, redundancy, and duplication. Right. We can wring so much more efficiency out of the system if we spend more smartly for healthcare.
Okay, good. I don't know if you can take one more. I think we have to stop. But this one was about big pharma. But if you can come back, will you promise you do that?
I would be happy to. I'm an educator at heart, and so happy to help out as I can. Again, I hope that at the end of this hour and 20 minutes that all of you have found this to be worth your time. Obviously, it's an important topic.